How do environmental factors affect cystic fibrosis severity? Imagine a world where your genes set the stage for a health story, but the environment writes the chapters that follow. That's especially true for cystic fibrosis, a genetic condition that affects the lungs and digestive system. While the root cause is a mutation in the CFTR gene, how severe the disease becomes can be influenced by the environment around us. Air pollution is one of the biggest environmental factors impacting cystic fibrosis. When people breathe in pollutants like tiny particles from car exhaust or chemicals like ozone and nitrogen dioxide, it can cause inflammation and oxidative stress in the lungs. This damage makes it harder for the lungs to clear mucus and fight infections. Studies show that living near busy roads or in areas with high traffic pollution often leads to more frequent lung flare-ups and faster decline in lung function for those with cystic fibrosis. Climate and geography also play a role. Warmer, humid environments may increase the risk of certain bacterial infections like Pseudomonas aeruginosa or Burkholderia species, which are common in cystic fibrosis. These bacteria thrive in specific climates, and seasonal changes can influence when infections occur. For example, some infections tend to spike during warmer months, making disease management more challenging during certain times of the year. Socioeconomic factors and the quality of housing can indirectly affect cystic fibrosis severity too. Families living in areas with higher pollution, limited green spaces, or poorer housing conditions may face more challenges in managing the disease. Limited access to health care or resources can make it harder to stay on top of treatments, which can lead to worse lung health over time. On a biological level, pollutants cause cellular damage in the lungs by increasing oxidative stress and inflammation. This accelerates the damage caused by cystic fibrosis, which already involves thick mucus buildup, recurrent infections, and progressive lung tissue destruction. The environment can essentially tip the balance, making the disease more severe or harder to control. In summary, while cystic fibrosis is inherited, environmental factors like air pollution, climate, and socioeconomic conditions significantly influence how the disease progresses. Reducing exposure to pollutants, improving living conditions, and understanding regional risks can help manage the severity of cystic fibrosis. Always remember, individual experiences vary, so it's important for those with cystic fibrosis to work closely with healthcare providers to tailor their care. Protecting lung health involves not just medical treatment, but also being aware of and minimizing environmental risks whenever possible.